So MedRock Week is a perfect match for us because we have the customers, we have a platform which enables us to store this data and manage it. What we need is applications, and there's nothing better than young students who do not have any predispositions in terms of what cannot be done.
Healthcare is a major part of our society nowadays. Something like 15% of the working population is employed in health and care in developed countries, so it is a big industry that impacts us all. But there's always this information that we need to bring together to improve care. We need young persons' perspectives, we need multidisciplinary perspectives from computer scientists, engineers, business people and medics, and an environment like this where they can come together, look at what's there and provide fresh thinking, I think is wonderful.
These students can actually test their ideas. We as a company provide the infrastructure to do that, to make sure that they can quickly build these applications and solutions. And then we also expose them to the customers themselves. So I think it's a really good approximation of the environment they will likely face when they start building this professionally.
The leading global cause of death is chronic disease. The majority is lifestyle diseases. In other words, they're preventable. It's what we eat, it's when we eat, it's when we don't eat. It's how we sleep, it's how we move, it's our stress, it's quite possibly our emotions. So it's how we live our lives is actually the global killer. Why is this exciting? It's because we get sick, then we get measurements. There's a new industry waiting to be born which we could call scientific wellness. I might call it hyper well-being. But what it's looking at is stopping us getting sick in the first place.
I think it's less about the technology and more about the workflow. So if we take technology and just drop it into an existing work setting, that often doesn't work as well as it should. So we need to be thinking about how the workflow might be evolved and adapted and improved in conjunction with the technology, making best use of the technology, but not allowing the technology to dominate the particular process. In healthcare is an information business, it's a people business, and so we need to make sure the technology supports those things rather than dominates.